Back, everybody. A new law takes effect on September 1st, aimed at helping to bring more doctors here to Texas. House Bill 2038, known as the Doctor Act, allows experienced international medical graduates to skip residency programs required here in the U.S.
This comes as some projections show Texas is facing a shortage of as many as 10,000 doctors and could be by the year 2032. So here to share his thoughts about this approach and the potential challenges that could arise with it is Dr. Ogon Gurel. He's a physician and faculty expert at the University of Texas at Arlington's College of Business Healthcare Administration program. Dr. Gurel, thank you so much for joining us today.
Thank you very much.
So help us better understand the landscape and the situation that our state is facing right now. What's driving this shortage in doctors and physicians?
Well, I want to set the big picture. First of all, many states are actually experiencing this, but Texas in particular, and in particular in the rural regions. So geographically, it's a wider problem with it being quite acute in Texas. And then also time-wise, this actually doctor shortage has been anticipated since the 1990s, as people obviously saw the demographic trends with aging of the baby boomers, increased healthcare utilization, and aging of the doctors, obviously, and retiring. And so this has been since the 1990s. And it was really accelerated, of course, during the COVID pandemic with a lot of healthcare professionals leaving clinical practice, burnt out, et cetera. And then also, particularly in Texas, with the growth in the population and a lot of incoming residents. So this has been a long time problem and a widespread problem, but particularly acute in Texas.
Clearly, so many factors contributing to this, and it was top of mind for lawmakers during this previous session because, as we mentioned, the Doctors Act allows international medical graduates to bypass U.S. residency, though they have to meet certain criteria for this. Anybody who might hear that and be concerned, what would you like them to know about this alternative pathway?
Well, international medical graduates has always had the capability of practicing the U.S. with a lot of um, obstacles or appropriate regulations, passing board exams, doing residency training, etc. One of the particular challenges in Texas is, and I think Texas is the worst state in this regard, is the number of residency positions for U.S. medical graduates is actually less per medical student in Texas than it is in many other states. In other words, for every 10 medical school graduates from Texas, there are only 9 residency positions approximately. In other words, there's more medical school graduates in Texas than there are residency positions. So in effect, Texas is exporting doctors to other states. And so the real challenge, the ultimate challenge, apart from the general demographic trends I outlined, is the lack of residency positions. Now, there's also been in the legislature attempts to increase the funding for residency positions. And the interesting thing is, many of the listeners may not know, is that residency training is quite expensive, perhaps $1 million per resident over the course of the 3 to 5 years or so. And that's largely funded by Medicare and Medicaid, mostly Medicare. So in other words, federal government funds essentially residency training as part of the Medicare system, even though obviously they take care of other patients and so forth. And so the state has been trying to bring more state funding, and with changes in the federal government, this might become an increasing trend. But that takes time, and I think that's the fundamental solution. And to kind of bridge that has come the Doctor Act, where foreign medical graduates, first of all, don't have to take the residency, which would further lock out more Texas medical graduates, so making the situation worse, as well as with documenting their experience, et cetera, be able to practice in areas that are underserved. So the fundamental problem is the lack of residency positions.
Talk to us, you said, a long-term solution with more funding there, but how sustainable do you think the solutions provided by the Act will be? Will it resolve some of the shortages that we're seeing here in Texas, particularly in our rural areas?
Well, it's hard to say. I mean, there's always been attraction for foreign medical graduates to come to the United States. and certainly the pay scales are higher, and there may be family reasons and whatever. So it's hard to say what the motivations are. The landscape, the political landscape is changing. Um, and so in terms of practice opportunities, one of the challenges, another challenge is that in those rural areas where the doctor shortage is particularly acute, some counties in Texas, rural counties, don't even have a primary care doctor. It's not so much the availability of the doctors, which there is a shortage, as we noted, but also the lack of infrastructure and the lack of sophisticated equipment to support practice. So it makes it very frustrating and unattractive to doctors, foreign or otherwise. So I think that's another challenge that needs to be met is in those rural regions to have the infrastructure, the hospitals, and the support to really support a doctor out there. You can't just send a doctor. I mean, it's very important, obviously, but there's a lot that goes behind that. And with a lot of the cuts going on, particularly around Medicaid, which serves a rural population, that could actually make it even more challenging. So we do have some short-term challenging situations. I mean, the Doctor Act might be helpful. I think in principle it can bring doctors in quicker, but it's as we say in medicine, just a band-aid solution for the symptoms. And the sustainable solutions are more infrastructure, more investment in rural health, and more residency positions are the long-term sustainable solutions.
Well, Dr. Gurel, we will leave our conversation there, but you certainly provided a lot of helpful insight for us, and hopefully we can continue these conversations at another time. But thanks again for joining us here this afternoon.